Hi, everyone. I'm Lori Johnson, CBN's medical reporter, back again to answer your email questions about COVID-19. We do this twice a week, and if you have a question, email it to newsanswers@cbn.org. Today, we're joined by physician and best-selling author Dr. Don Colbert, creator of Divine Health Nutritional Supplements. His website is drcolbert.com. Welcome, Dr. Colbert.
Hey, it's great being here.
Well, before we get to the questions, I noticed an interesting section on your website addressing myths associated with COVID-19. What are some of the misconceptions about the virus?
Well, some people say, oh, it's just a flu. It's just similar to a flu. No, this is much more highly transmissible and has a much higher fatality rate than the flu. But one of the biggest misconceptions is if someone coughs or sneezes, people think, oh, it's only in the air for just maybe a few minutes. No, it can be in the air for as long as 3 hours. And so if you're strolling through the grocery store or Walmart or Target and someone sneezed 3 hours before and that's airborne, then you walk through that area and you've just been exposed to the COVID-19 virus, and it can go up to the nose. That's usually where it infects us, or the mouth, or even the eyes. But usually it gains entrance into our system through our nasal passageways.
Wow, Please continue.
Right, so that's why we need to isolate ourselves. And if we do go to one of these places, we need to, like Walmart or shopping, we definitely need to cover our mouth with a face mask or with a handkerchief or something. And I wear goggles well, not goggles, they're eye protective wear that literally covers my eye totally, because it can even get in your eyes, especially if someone sneezes forcefully, it could gain entrance.
Wonderful.
But there's other common myths. A major one I hear all the time, oh, in the summer it's going to be warm and the virus will go away. Not so with this virus. Again, this virus is in warmer climates too, and dissimilar to the flu. The flu usually goes away in the summertime, but it's not been shown to be the case with the coronavirus. So Those are just a few. And I have many more on my website.
All right. Well, let's get to those email questions. Mark writes, if we already have items such as soap that kill the virus, why is it so hard to find a cure if we already have things that kill it on the outside?
Well, again, it can easily be killed on the outside because, thank goodness, we have skin protecting us. But it can live on our skin or on surfaces for quite a long time. On surfaces, it can live for 3 days, as long as 3 days. But it's so hard to kill on the inside because this is a new virus. Our immune system has never been exposed to this virus. So many people have a sluggish or an impaired immune system, especially as we get older. And so it just can't fight it adequately. And as a result, quite a few elderly or people with predisposed diseases like diabetes or heart disease or lung disease or asthma, or who are immunocompromised and on chemotherapy, or over 65, they're more prone to more dangerous problems such as pneumonia. And so that's why it's so important that we need to take these precautions, especially social distancing and social isolation and hand washing and hand sanitizers, but also cutting our fingernails. I cut my fingernails really short because that virus can hide up under your fingernails, and a lot of people don't clean up under their fingernails, especially if they're long. So keep those fingernails trimmed short, ladies. Listen to me. It's really important so that we don't keep spreading this virus around.
All right. Marie asks, can you get the virus a second time?
Very good question. And unfortunately, we don't really know. This is the first time. And they've done studies. A lot of what we know about the virus, we're learning from China. And one Chinese study using rhesus monkeys found that once they had been gotten over the virus and they had the antibodies, then they re-exposed them to the virus and they didn't get infected. So that was one small study, but they don't know right now. More studies need to be done because, yes, potentially we may get infected afterwards, after we've been exposed and we've gone through the infection. But right now they're not sure, but they say chances are probably not nearly as infectious as the first time around.
Healed Now emailed this question. What kind of plan can there be to treat traumatized healthcare workers?
Very good question, especially those in New York. Oh my goodness. And a lot of them are traumatized because they're having to park freezer trucks outside to load in the corpses. So they need to start some online, or someone needs to do this. If it's a ministry, hopefully a Christian-based ministry support group for traumatized healthcare workers. And again, when people are able to communicate and receive the emotional support and everything from an online support group, especially Christian-based, I think it'd help a lot of our healthcare workers who are on the front line of this. And we need to offer our prayers and emotional support to those healthcare workers.
Dale wants to know, should the more vulnerable seek testing as soon as possible if early detection helps people recover better?
If we had more tests, I'd say absolutely. Right now, even here where I'm in Orlando, we don't have that much testing capabilities. They just opened today a testing site at University of Central Florida. So again, it overwhelmed the system because we simply don't have enough tests yet. Now, I said the word yet because hopefully in the next week or two, that situation will be remedied. And when it is remedied, especially with the new Celex Mayo Clinic developed test for antibodies, I want to have that test as soon as it's available. It just came available this week for a few places around the U.S. But that's the key test to see, because you can tell if you have it or if you have antibody protection against it. And then you can actually, if you have the antibodies against it, you can offer your convalescent plasma to help treat others, which is amazing. So I think that more testing needs to be done, absolutely, if they were available.
Here's an interesting question, Dr. Colbert. We know you are a faithful follower of Jesus, and Sue asks, how is God related to coronavirus?
Oh, good question. Very good question. Well, again, some people think that this coronavirus may be the fourth horseman of the apocalypse in Revelations. It's actually Revelations chapter 6, and I'll read it, verse 8. When the Lamb broke that's the fifth seal. Let me go to the fourth seal. It says, here it is. When the Lamb broke the fourth seal, I heard the fourth living being saying, "Come." I looked up and saw a horse whose color was pale green. Its rider was named Death, and his companion was the grave. These two were given authority over 1/4 of the earth to kill with the sword and famine and disease. There's your COVID-19 and wild animals. So again, that may be, but I think this is a predecessor of this great pestilence to come. And again, you look at Deuteronomy chapter 14, Numbers chapter 11, the forbidden food. And remember that a lot of people believe that this pandemic stemmed from eating bats or kivets, which are like weasel-like creatures that were sold in the wet markets in China. See, the Chinese eat a lot of foods that would be forbidden food according to the Bible. And again, bats are forbidden food. If you read Deuteronomy chapter 14, I believe it's verse 18, we're not supposed to eat bats. And especially if they're not properly cooked, because they can harbor viruses and weasel-like creatures and, rats and possums and raccoons. Well, these wet markets will have baby crocodiles, giant salamanders, bats, raccoons, all kind of strange animals that are forbidden in the Word of God. And so again, that's how I believe that's how SARS, they believe, was transmitted by the bats. So again, when you eat these foods we're not supposed to be eating, we're inviting in all kinds of viruses and bacteria that could potentially kill us.
And last question, Laura asks, if someone sneezes, how do you know and convince others it's allergies and not the coronavirus?
Very good question. You don't. That's why you got to take precaution. You've got to wear a face mask, or you got to wear a scarf or a handkerchief around you or something to especially protect your nose. But also I tell people, don't forget your eyes. At least wear glasses. Or wear the Oakleys or the Oakley light glasses that come wrap around so they give you shield protection. And even better, get you the goggles that I have, or they're like glasses that fit snugly to your eyes, and it prevents any floating particles from entering in. But good question, very good.
All right, well, that's all the time we have for now. Our thanks to Dr. Don Colbert for his time and expertise. Once again, the website is drcolbert.com. Thank you so much, Dr. Colbert. And if you have coronavirus questions, email us at newsanswers.org. I'm Lori Johnson. Thanks for tuning in, and we'll see you again next time.